Hi, everyone. My name is Ruth Berhanu, and today I'm excited to talk to you about a treatment adaptation called Telehealth Enhanced Multisystemic Therapy, or TEMST, which is a blended approach that takes the proven success of standard MST and combines it with the flexibility of telehealth. Each year in Colorado, thousands of youth are arrested and hundreds end up in residential placements for showing antisocial or delinquent behaviors. An MST is a treatment program to keep youth who are very high risk for out of home placement at home by working within their ecosystem. The problem is, not every youth in Colorado and their families are able to receive access to this program. Therapists work 24/7 to provide this intensive 3 to 5 month in home intervention that's proven to reduce out of home placements for youth, but rural areas struggle to keep MST teams going due to high service demands and the related costs. In our study, we recruited 5 Colorado MST teams who dedicated about one therapist per team to serve 6 enrolled families. So that's 30 families total. We asked, is it easy to implement? Does it stay true to the original model? And will the outcomes be the same? These teams followed standard protocols, including expert consultations and fidelity monitoring throughout the pilot. We use a mixed methods design, collecting surveys at baseline, 6 months, and at the 1 year mark, alongside other qualitative data from monthly learning community meetings, which provided additional support for implementation and helped our therapists to make any course corrections. So, is telehealth enhanced MST feasible? We found that it was. Despite early adjustments to telehealth, both supervisors and therapists faced minimal barriers over time. One therapist even shared their thoughts in regards to how removing those barriers helped with the flow of their sessions. We were also regularly receiving feedback from our therapists that the families would choose to use their own technology. For example, they expressed their comfort levels and confidence with using their own tablets, making implementation easier and overall cost effective. Telehealth enhanced MST maintained fidelity to the standard model with an overall therapist adherence score of 0.83, which is considered above the average, and proving telehealth really aligns well with traditional delivery. As you may have noticed by the high percentages on the previous slide, we were having overwhelming success with the pilot so far, but it also just showed us that telehealth enhanced MST did not diminish service quality, but rather offered flexibility for teams and their families too. So another key question, were the clinical outcomes similar to the standard delivery? Again, positive scores here. 100% of youth lived at home, 97% were in school or working, and 87% had no new arrests while receiving treatment. Keep in mind, our teams worked with youth who are all still at risk of out-of-home placement at the end of the pilot. We only want to note that these numbers are as good as or higher than what we see across youth who are using MST in general. Similarly, for implementation outcomes, telehealth enhanced MST matched results similar to traditional delivery. Here, all of our youth completed treatment, no youth were discharged or were placed out of home, and we met or exceeded all of our target goals. So really positive outcomes across the board here. Families remained committed to the program and adhered well to the treatment, as our surveys showed high levels of engagement throughout. One MST therapist echoed this here. Engagement in telehealth enhanced MST was comparable to standard delivery, and of the 6 families they worked with, only one faced challenges which were unrelated to the pilot itself. Conducting parent-child interactions and UA screenings proved to be challenging through telehealth, but these components are difficult to manage even in standard MST anyway, so we hope to explore them further in a larger trial and look forward to collaborating with MST teams to find creative and supportive solutions. A key lesson learned was the importance of enhanced therapist training to overcome telehealth specific challenges. Our learning community helped us develop a revised decision making tree, offering guidance on telehealth suitability for families and shaping initial trainings for newer therapists. And we saw about a 4 to 5 month learning curve with that. This telehealth adaptation has opened access to therapy for youth in rural communities who otherwise wouldn't have received MST, and flexible delivery models may enable us to reach families with diverse clinical circumstances, address safety concerns, and better engage distant family members and other supports. At the end of our project, we held a reflection session with our participants. If you're interested in that deeper dive, you can pause the video and scan the QR code here to access our final report. For now, here's a word cloud that highlights in their own words the impact this pilot had on them, and we were happy to see that collaboration aspect was the most memorable. Overall, these results showed us that there is a need to pursue funding opportunities to confirm comparative effectiveness with traditional MST delivery. We hope to continue sharing these results to help inform decisions regarding Medicaid billing for telehealth. There's also a need to focus on workforce identification and retention to build a lasting workforce. We saw good signs during the pilot that families experienced telehealth as a positive based on therapist feedback and very low treatment dropout, but we recognize we didn't collect family level perspectives, so we would like to do this in a larger trial and evaluate those outcomes. In MST, there's this phrase of doing whatever it takes, meaning to go above and beyond to meet the needs of youth and families. Telehealth enhanced MST aligns with that definition because it translates to delivering services flexibly, and the team you see listed on this slide continues to carry out that vital work every day, and we hope to continue to see the impact that this adaptation will have in the future. Thank you.